Why do other countries call Alzheimer's and dementia type 3 diabetes? I'm Dr. Dave Morris with Magnolia Medical Center. We are a root cause functional medicine center. We've been doing root cause and functional medicine before it was a buzzword, right? So we've got 60 years of experience. Obviously, I'm not 60 years old, so it's not all my experience, but my team has 60 years combined experience in functional and root cause medicine. We also do responsible pain management. Our whole reason why I come to work every day is to help people without the use of drugs and surgery and making sure this happens for people. We want to get people healthy and well. Today, I want to talk to you about Alzheimer's and dementia and why their whole healthcare system is calling Alzheimer's and dementia a blood sugar problem. They're calling this type 3 diabetes, okay? So why is this? Just so you know, do I agree with this? Yes, I do. I agree that now not 100%, we can't say that every single case of Alzheimer's and dementia is due to a blood sugar dysregulation, okay? But 98% of cases of Alzheimer's and dementia are from a blood sugar dysregulation, a blood sugar problem, okay? And what ends up happening is because what blood sugar does to our blood vessels and to our nerves, it creates nerve degeneration. So yes, neurodegenerative changes are going to be worse, and they can even be caused by blood sugar problems. One of the reasons why we are, in this country anyway, we are so sort of against jumping on this idea that it's type 3 diabetes or a blood sugar problem is because this is conspiracy theory mind for me in the healthcare system. I don't believe that our healthcare system has your health at interest at all. I believe that our healthcare system is designed to do one thing, and that one thing is to make the system money. They don't care about your health. And that is a problem for drug companies that are trying to sell Alzheimer's and dementia medications. It's a problem for assisted living facilities. It's a problem for the whole industry. There's some data that says the most expensive disease that we know of in the United States is diabetes. I thought it was cancer. I would even say because so many people die from it. So heart disease is number 1 killer in this country. Cancer is number 2. I would say those are more expensive. But the research says it's diabetes because you can have it for so long. It takes a lot of money to manage, and there's so many comorbidities that go along with this. What happens if we take all the money away from the Alzheimer's and dementia crowd, so to speak? They're not going to like that. Now, there is not a lot of evidence that has been done so far that says fixing a blood sugar problem late in life is going to fix dementia and Alzheimer's. And I think you're going to see a lot of arguments that say, well, we don't see that because fixing this blood sugar problem isn't changing the degeneration of those nerves. Folks, we're catching these problems late in life. People are seeing these problems when they're younger and younger. This is happening. We're seeing more and more people at earlier ages experiencing dementia and Alzheimer's because of blood sugar problems, poor diet over many, many years. It's still a later in life problem. Nerves take a very long time to heal and repair. So let's say we catch somebody with Alzheimer's dementia at the age of 65. They might not have enough years to show significant cognitive changes if they fix their blood sugar at the age of 65 or 70. That might not be enough time, okay? So I think it's a little bit difficult based on what is considered research in this country, to show that, hey, if we fix a blood sugar problem, it may or may not fix a cognitive problem. I hope you understand why that might be. But it is a blood sugar issue. If you want to prevent Alzheimer's and dementia, and again, 95 to 98% of these cognitive decline issues, at a young age, start handling and making sure your blood sugar is good. Now, when I say handle your blood sugar, that doesn't mean go get your fasting blood sugar and your A1C tested and you go, oh, it's fine. Because it doesn't mean it's fine all the time. It just means that you're able to handle it. You need to have a good low carb, low sugar diet. I'm not saying no carb, no sugar. You should have a low carb, low sugar diet your whole life. It will give you better cognitive health later on in life. You can check out the research on this on your own. But the cultures that live the longest eat the least. They also eat healthy meats, fats, vegetables, and fruits. They don't have a high level of grain, especially the grains that we eat in this country. The stuff that we have in this country is just, it's just poison practically. So if you want to live long and have a lot of life in your life, very low carbs, low sugar diet to help avoid the blood sugar issues that are going to lead to dementia and Alzheimer's, called type 3 diabetes. Check it out. You're going to see some arguments to say, no, type 3 diabetes is not Alzheimer's, or Alzheimer's dementia is not type 3 diabetes. The research shows that it is. Anyway, I'm Dr. David Morse at Magnolia Medical Center. Do me a favor, hit the subscribe button, hit that now, hit that button for me. Also, like this video and leave me some comments. Let me know what you think here on this subject. Maybe you have a family member that's dealing with Alzheimer's and dementia, and maybe you've seen that their diet has impacted their cognitive health. Let me know what you think. I'd love to hear it. Thanks.